So, bring this in close. This is Jupiter's, technically his second dose, but his first dose where he's gonna be on this regularly for the next year. So can you see that there if you zoom in? So we're getting him on testosterone. We found out about this therapy researching online, and there's a treatment that a doctor created that's called Dogosterone. And so what we're doing is Jupiter's neutered. He's 12 years old. He's starting to lose a little bit of his mobility, slowing down as he gets older. And since he doesn't have his own testosterone because he is neutered, we are doing this Dogosterone therapy. So the prescribed dose for his weight, he's 115 pounds, is 0.6 mLs per month. But in order for him to have more T levels, we're gonna do an injection every 10 days at 0.2 mLs to try to keep his T levels more even so he doesn't have these big peaks and valleys. So today's gonna be his first injection, and we're gonna do this as kind of a once a month or maybe once every 10 days update on Jupiter and how he's doing on the testosterone therapy, and how, if he's had improvements or any side effects, or just kind of monitoring his progress as we do this therapy. So again, Jupiter, he's an Alaskan Malamute, he's 12, and I've had him since he was a puppy, since he was 7 weeks old. So, Jupy, come here, buddy. Come on. I want to show you, as he gets up, you can see his hind legs, he's a little bit slow to get up. Come here, come on, buddy, up. Good boy. Can you sit? Sit. He has a hard time sitting. He just kind of falls down. Okay, come on, up. And he's excited now because he thinks this is a treat. But without him thinking it's a treat, he's even slower at getting up. And he's actually gotten to the point where he can't really go up the stairs anymore. He can't get in and out of the car. We have to lift him. So we're hoping this will improve his quality of life by increasing his activity, his muscle mass, so that he's more able to get around. So we'll stop the video here and we'll start again when we do the injection. All right, so we've got 0.2 ml of the testosterone. It's a 20 gauge needle, so it's gonna hurt. So here we go, first injection. Right here in the hamstring on his left side, and we're gonna alternate sides. Try not to poke myself. Okay, Jupy. Sit still, buddy. Wow, he didn't even make a noise.
You did good.
Boy. Oh, good boy, Jupy. You are so tough. Yeah.
You go, boy.
Good boy. Here, let me see it. Here, can I hand this off to you, baby, without poking? Good boy. So first injection's done. Left hamstring. He didn't even make a sound. So good boy. I didn't even know if I got it in there or not. I don't feel any wetness or any blood. Definitely got it in right there. So what I'm doing is I can feel his, you kind of grab a hold of his hamstring, you can trace down his femur and make sure you're grabbing hold of the meat. You want to make sure you're not in a vein. And then that's it. Good boy, Jupies. Good boy. Okay, week 2, second injection for Jupiter. He's getting another 0.2. So we gave him the first shot in his left rear hamstring. So now we're going to do the right side, which he laid down perfectly for us. All right, buddy, I love you. I'm so sorry I have to do this to you. Okay? So there's the meat right here. Got his hammy, there's the bone, right here at the tip of my thumb. He's got so much hair. All right, Jupy. He doesn't even make a sound. Good boy. Good boy. Good boy. Malamutes. Good boy. Okay. You want a treat? Come on, come on. Good boy. Good boy. Okay, down, down, down. Stay, stay. Come. Good boy. Good boy. Soft, soft. Good boy. Okay. So left leg. Okay, down. Lay down. Come. Down. Good boy. Okay, I need you to go this way, buddy. This way. Good boy. That's a good boy. Okay, so left leg. Alright. This is third shot. 0.2 again. Just like the other time. So this will be his final dose for the month. Good boy. Yes, that's a good boy. Okay. I've already prepped it, so let me get it in the hand here. Okay, just sit still. Let me see your leg. Okay. Right there. Okay, tip of my thumb. He doesn't make a sound. That's it. Good boy, JBs. Good boy, buddy. Okay. You want a treat? You want a treat? We've been feeding him this brisket. Want a treat? Come. Come. Okay, stay. Stay. Down. 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 No. Come here. Keep hands up. Okay, down. Down.
Just have him roll over.
He's like, please give me that. Okay, roll over. You're already doing it. Okay, stay. No. He's so excited about this. No, leave it. Leave it. Okay, buddy. Good boy. So I think he's making progress. He's moving a little bit quicker, up, down. He goes up our stairs now a little bit better. I think he's a little more energetic, active. We see him walking around the yard more. So 3 weeks in since his first shot. Good boy. Here's some of Jupiter's food. He's already eaten some of it, so I'm just gonna give him that. Normally we won't chop it up because we want him to chew it so it works out his jaw, slows down his eating, cleans his teeth. But we've got this meat, it's cut up. It's just some brisket and an egg cracked in there. So this is gonna be his food for the day. You ready, buddy?